お待たせいたしました。定刻になりましたので、ご案内を差し上げましたように、財務省、世界銀行、女性、子ども、青少年のためのグローバルファイナンシングファシリティ、GFF、日本国際交流センター4社の、共催で、共催させていただきます、東京栄養サミット公式サイドイベント、Investing in Nutrition Role of Catalytic Financing を始めさせていただきます。私は日本国際交流センター理事長の大河原と申します。本日のイベントの進行役を務めさせていただきますので、よろしくお願いいたします。JCIE では2007年より政治行政、学会、産業界、市民社会といった多様なセクターの連携を促しまして、人間の安全保障を理念とした日本のグローバルヘルスへの貢献を後押しするさまざまな事業を実施してまいりました。2018年からは誰一人取り残さない保健医療体制の構築を目指す UHC に寄与するし得るものとして GFF に関する情報発信、理解促進を進めております。本日のイベントを通しましてコロナで後退したとされる栄養を含む基礎的な保健サービスの提供体制を再構築する流れが後押しされ、脆弱な状況に置かれております方々の健康改善が進むよう祈念している次第であります。本日は日英同時通訳が入っております。通訳音声をご利用の方は画面右下にありますボタン、そしてパソコンからお入りの方は通訳のボタン、そしてスマートフォン、タブレットからお入りの方は詳細というところから言語通訳をお選びいただければと思います。では、早速ですが、最初に JCIE のシニアフェローとして、JCIE のグローバルヘルス事業をご指南いただいております、武見敬三参議院議員より開会スピーチをお願いしたいと思います。武見先生、よろしくお願いいたします。
はい、ご紹介ありがとうございます。日本の参議院議員、そして JCIE のシニアフェローで、WHO の UHC の親善大使をしております、武見敬三です。この東京栄養サミットの期間にこのようなファイナンシングに焦点を当てたイベントを開催できること、大変嬉しく思っております。で、日本は2015年の SDGs の中にユニバーサルヘルスカバレージを組み込むことに大変貢献いたしました。そしてその後改めてUHC のファイナンスに着目をして、2016年、世界銀行と WHO と協力して、世界銀行の春の総会で UHC に関する財務大臣会合を実施しました。2019年には日本がホストを務める G20 で、この財務大臣、保健大臣合同会議が開催され、それ以降の G20 もこれを継続しております。当該国の財務当局が保険の重要性を認識して、各国内において保険に対する投資を優先化する意思が醸成されることが非常に重要です。で、その上で、世界銀行及び、この GFF、グローバルファイナンスファシリティなどが果たしている役割は極めて大きいと思います。で、栄養というと、ユニバーサルヘルスカバレッジとは直接関係がないというふうに思われる方もいらっしゃるかもしれませんけれども、ユニバーサルヘルスカバレッジというのは、この WHO の定義によってこのように、設定されています。このすべての人が適切な予防、治療、リハビリなどの保健医療サービスを支払い可能な費用で受けられる状態というふうに定義をしています。で、栄養はユニバーサルヘルスカバレッジの予防に直接大きく関わるサービスということになるわけでありまして、その点で非常に重要です。で、栄養不足が妊産婦や子どもの命、そして子どもの成長に与える影響は、指摘するまでもありません。この COVID-19 に関連する混乱により、その影響が深刻になっていると聞いております。また、非感染症疾患の重要なリスクファクターであります、今度は栄養過多、不良への対応も求められています。昨今の世界疾病負荷研究の報告書によりますと、低中所得国においても、非感染性疾患により生ずる疾病負荷が1990年には全疾病負荷の3分の1ほどであったのですが、2019年には3分の2近く、なんと2倍近く上昇しているというふうに言われております。で、加えて COVID-19 による死亡数の増加の背景として、慢性疾患、とりわけ糖尿病であるとか、 循環器系の疾患などの非感染性の疾患、また肥満などの関連リスク要因が大きく影響していることが指摘されています。で、感染症に強い、この体を作っていくためにも、栄養の取り組みというのは不可欠でございます。したがって栄養をユニバーサルヘルスカバレッジ政策に主流化することは、人々の病気の予防に加え、今後のパンデミックを未然に防ぐためにも極めて重要なことと言えます。で、そのため私が会長代行を務めております国際母子栄養改善議員連盟などの関連議連から本サミットに向けて提出した提言の中でも、ユニバーサルヘルスカバレッジの中に栄養を盛り込むことを提言しているわけです。で、日本では終戦直後より国民栄養調査を実施いたしまして、国民の栄養摂取状況というものや体格などを網羅的に把握をし、それを踏まえた政策を策定しています。で、1947年には栄養士という専門職の制度を設けました。そして1951年からは衣食住に関わる生活改善普及事業を全国で展開をし、保健所による栄養指導や巡回型の車両による栄養指導なども実施されてきました。で、青少年に対しては戦前に導入した学校給食、それから米国やユニセフの支援を受けて復活させ、この戦後の貧困期における青少年の栄養を改善したという経験を持っています。で、このように日本は栄養を保健や教育といった多分野にわたる政策に取り込み、栄養改善を通じた健康づくりを進めてまいりました。で、来週にはIDA、インターナショナルディベロップメントアソシエーションの増資会議も東京で予定されております。で、世銀のIDA、IDA や栄養改善拡充のための日本の信託基金、それから GFF、グローバルファイナンスファシリティの支援を通じて、各国のオーナーシップの下で栄養改善が保健政策全般に関わるものとして位置づけられ、特に脆弱な人々の健康改善が進むことを記念して、私の開会のスピーチにさせていただきたいと思います。ありがとうございます。
竹西先生、どうもありがとうございました。それでは早速ですが、続きまして、マリー・パンゲスト世界銀行専務理事から開会スピーチをいただきます。パンゲスト先生には JCIE も長年にわたってさまざまな事業でご協力をいただいてまいりまして、久しぶりにこのオンラインではございますけども、このような形でお会いできて大変ありがたく嬉しく思っております。パンゲスト専務理事は2020年3月より現職におられまして、世界銀行において保健、栄養、農業、食料といった各開発分野を扱うグローバルプラクティスグループの業務を統括されておりまして、GFF の増資キャンペーンの共同議長も務められております。それでは、パンゲスト専務理事、お願いいたします。
こんばんは to those of you in Japan. Good day to everyone else. Thank you very much, Okawara-san. It's good to see you again for your kind introduction. I'm truly honored to be opening this important event with Professor Keizo Takemi, who is globally renowned for his long-standing commitment to global health, especially universal health coverage and the important role of nutrition. I would like to commend Japan's leadership in successfully organizing the Tokyo Nutrition for Growth Summit. I also appreciate the growing Japan World Bank Partnership for Nutrition, including through the generous commitment of $20 million for the third phase of the Japan Trust Fund for Nutrition, a new $50 million investment through GFF, and perhaps most importantly, Japan's leading voice in advocating for nutrition and human capital in the IDA 20 dialogue. Malnutrition imposes extremely high costs on the global economy, estimated at over $5 trillion of productivity losses annually. The COVID pandemic will likely lead to an estimated additional 13.6 million more wasted children and 3.6 million more stunted children by 2022, with an additional $44 billion economic losses annually. This is on top of the 150 million children who were stunted before the pandemic and 45 million who were wasted. As President Malpass mentioned yesterday, of the 48 countries with the lowest human capital index, 41 have high child stunting rates. And many of these same countries also have high obesity rates and non-communicable diseases. Ironically, this double burden of undernutrition and obesity often coexists in the same countries and often in the same families. Malnourished people also suffer the worst impacts of COVID-19. For example, obese individuals have a nearly 50% greater chance of dying if they contract COVID-19, and a much greater chance of being hospitalized. Imagine what burden this imposes on the already overburdened health systems. The World Bank Group is committed to scaling up its response and commitments to food and nutrition security. The Japan Trust Fund for Nutrition and the GFF have provided invaluable support in over 40 countries to enhance the quantity and quality of the IDA and IBRD nutrition portfolio through technical support, capacity development, strengthening policy dialogue, investment decisions, and programming. These have been key catalytic forces behind the scale-up and will continue to be critical for client governments to fulfill their nutrition for growth commitments. For example, we have recently completed a global paper on positioning nutrition in universal healthcare, optimizing health financing levers, supported through the Japan Trust Fund and GFF. The report provides actionable recommendations on how nutrition services can be effectively and sustainably financed through universal healthcare. This is complemented with guiding framework for a malnutrition public expenditure review and expenditure tracking, which will help countries strengthen strategic allocation and effective use of resources for nutrition. The Global Financing Facility supports countries as they chart equitable and increasingly self-sufficient pathways to universal health coverage. Fighting malnutrition is core to this agenda, and women's and girls' nutrition is foundational for achieving gender equality. The long-term strategic partnership that Japan and the World Bank have built over time can further catalyze such transformative actions to make these investments in nutrition a priority, a key step in building human capital and a long-term solution to food security, economic prosperity, and building back better. We are extremely grateful to the government of Japan for championing this key development priority, which is really important, food and nutrition security. Arigato. Thank you.
パンゲス専務理事ありがとうございました。大変力強い包括的な開会スピーチをいただきまして感謝をいたします。ありがとうございます。それではここからパネルディスカッションに移りたいと思います。このパネルディスカッションはマーティン・バン・ニューコープ世界銀行農業食料グローバルプラクティスディレクターにチェアを務めていただきます。この、パネルディスカッションの際、視聴者の方々からのご質問も受け付けておりますので、チャット機能ではなく Q&A の機能の方を使ってお送りいただければと思います。英語でご質問いただける方は英語でご入力をお願いいたします。時間の都合で全てにお答えできないかもしれませんが、時間の許す限り登録の際に、頂戴したご質問も含めてディスカッションで取り上げていただきます。また、パネルディスカッション冒頭、ファン・パブロ・ウリベディレクターにお話をいただくことになっておりますが、その際、このウリベさんにご報告いただきます報告をチャットの方に栄養改善、拡充のための日本信託基金、並びに GFF に関する背景資料のリンク先を共有させていただきますので、ご覧をいただければと思います。それではお待たせしました。バン・ニューコープグローバルディレクター、パネルディスカッションのチェア、よろしくお願いいたします。
Very good. Thank you very much, Mr. Okawara, for your very kind introduction. Honorable Professor Takemi, distinguished guests and speakers and colleagues from all over the world. Greetings from a very early morning Washington, D.C. I'm very honored to be here at this very important event today at the Tokyo Nutrition for Growth Summit, titled Investing in Nutrition, the role of catalytic financing. I would like to thank the Ministry of Finance of Japan for inviting me to moderate the panel discussion. And this panel discussion will focus on why nutrition reflects an important investment agenda, what our partnership has done, not only at the global level, but even more importantly, at the country level, and how can we work further together, to achieve the global nutrition targets and the SDGs. Let me start by saying that poor diets, kill more people globally than tobacco and high blood pressure. And over 70% of the people who are overweight or obese, live in low income and middle income countries. According to the True Cost and True Price of Food report that was published as part of the recently concluded UN Food System Summit, the total hidden cost of the global food system, which includes a hidden health cost, are estimated at a staggering $19 trillion per year. 3 billion people cannot afford the cost of a healthy diet, which is estimated at $3.70 a day. So getting nutrition right requires investments that can catalyze the transformation of our food system to one that's not only productive and resilient, but also improves health and nutrition and delivers climate benefits. There are many strategic policy and investment choices across sectors that can drive action for better nutrition. This agenda is a very strategic priority for the bank's Food Systems 2030 initiative. It seeks to catalyze a transformation of the food system to deliver more durable food security and nutrition outcomes in our client countries. And we take the government of Japan's strong leadership and support in this area, and are very excited to hear today from different speakers on what we have achieved and how we can further harness the partnership towards 2030. Now, let me now welcome the 5 very distinguished experts we have at our panel discussion today. I will introduce each of you when you get the floor. And just take note that in the interest of effective time management, when there's a 1 minute left of the allocated time for your intervention, I will provide you a heads up to wrap up to make sure that we have some time for discussion. Now, let me turn to our first speaker and my colleague, Dr. Juan Pablo Uribe, who is a Global Director for Health, Nutrition and Population at the World Bank and the Director of the Global Financing Facility. Juan Pablo, let's hear from you now. What makes nutrition an essential element of global development agenda, such as resilient health system, universal health coverage, and human capital? And how has the World Bank Group contributed to mainstreaming nutrition and leveraging our other resources to scale up action in this space? So Juan Pablo, over to you. The floor is yours, and you have 15 minutes. Please go ahead.
Thanks so much, Martin. Respected Professor Takemi, Mr. Okawara, Mari, dear all, guests, panelists, I'm really honored to be here today and able to share with you the work that on nutrition we've been doing from the bank with Japan's generous support, both in the trust fund as well as in GFF, the Global Financing Facility. I do want to recognize all of the team who has been working behind these instruments in bringing better nutrition across the world, and my appreciation to all of them for their effort. Next slide, please. We can show the presentation. So in the next slide, we're going to be covering 3 main topics. The first one, which is extremely important, is why is it so important and so critical to invest in nutrition. We will also discuss briefly the value added from the Japan's Trust Fund, in the GFF, in the bank. And finally, we will share some country examples that bring also lessons learned for all of us. But before doing that, let me share with you a very brief video that has this very compelling argument for the importance of nutrition for all. So let's play that video at this moment, please.
Globally, over 150 million children under 5 are facing a silent crisis: stunting. Stunting is an irreversible impairment of children's physical and cognitive development, limiting their full potential for optimal growth. Childhood stunting, or low height for age, is a manifestation of chronic undernutrition and affects children younger than 5 years of age, with the most critical periods of growth and development being the first 1,000 days from conception to a child's second birthday. Childhood stunting has long-term effects on individuals and communities. Without concerted action with interventions and policies to reduce stunting rates in children, it can lead to huge losses in resources and assets already invested in a country's human capital, including knowledge, skills, healthcare costs, and labor productivity. Without human capital, countries cannot sustain economic growth, build a strong workforce, or compete effectively in the global economy. Stunting cannot be cured, but it can be prevented. Together, we're working to unleash every child's potential and paving the way for sustainable and inclusive economic growth in Côte d'Ivoire, Ethiopia, Madagascar, Rwanda, Tanzania, and beyond. Because investing in nutrition in the first 1,000 days from pregnancy until a child's second birthday is one of the smartest things a country can do.
Thanks so much. And again, thanks to all the staff for putting together such a compelling video. Stunting cannot be cured, but it surely can be prevented. Here we see the critical aspect of a timely, proper nutrition and the devastating impact of not being able to have such proper nutrition. So the need for investing in nutrition is huge. The cost of not investing in nutrition is also immense, and it has incredible cost on individuals and their future, on their families, and the communities in which they live, and also for nations. Next slide. Here we can see the very strong economic rationale for investing in nutrition. Just see the magnitude presented in the circles of the economic cost of obesity in this case, and the projections of such cost in many of the countries around the world if we did nothing to address this nutrition problem. Next slide. However, the positive message is that we can act and work together to address this nutrition challenge globally and country-specific. And we have approaches that have shown benefit and effectiveness in preventing stunting and malnutrition and addressing obesity. These approaches have as common elements an increasing country emphasis, a very important analysis behind them for choosing the correct interventions with the proper evidence base, and also in reaching out to fiscal policies and further strengthening the nutritional behavior in the community. Next slide. Japan has been a strong partner and a great global leader in this area. And thanks to Japan's generosity and leadership, we have the Trust Fund for Scaling Up Nutrition. And this is a very good example of instruments that deliver results on the ground for improving nutrition. It has, among many of its strengths, amazing capacity to leverage the mobilization of IDI and IBRD resources. It also contributes to capacity building at the nations, and it also brings analytical support. The three of these conditions are very important for strong nutrition programs at countries: the leverage of resources, the capacity building, and of course, the analytical support for evidence-based interventions. Next slide, please. Further working with this example of the Japan Trust Fund in the World Bank, I want to underscore what Professor Takemi said in his intervention, and it's the importance and the opportunity that we have of bringing together our pursuit of universal health coverage with the emphasis of proper nutrition for all. This can be done, and it's part of the same road path of improving health systems and bringing a better health for communities. What does it imply? It implies defining clearly a package of effective nutrition interventions, again, evidence-based. It also implies being able to discuss and agree on a longer-term financial framework for these interventions. And it also includes being able to track with correct data the services and the expenditures around this essential package of service. Here, the importance, for example, of having specific nutrition-focused public expenditures reviews. Next slide. I now want to shift from the Japan Trust Fund to the Global Financing Facility, the GFF, which also benefits from the generosity and the leadership of Japan and many other stakeholders in its work in bringing better opportunities for women, for adolescents, and for children across our regions. The GFF is also a very good example of a strong instrument for addressing nutrition challenges. Among its core features, I would like to highlight right now the importance of working with direct and indirect interventions, and that's proper of the nature of nutrition, of working across sectors with multi-sectoriality, of bringing evidence and analytical support, and very important, integrating nutrition to the healthcare delivery sites so that it's not an isolated or apart intervention, but rather, as Professor Takemi said, it is a core health intervention proper of the healthcare delivery sites as well. This, complemented with country ownership and country leadership, are a perfect combination for successful stories addressing nutrition challenges. Next, please. Following with the GFF, we want to highlight how nutrition has gained momentum and space as a needed priority in the efforts that GFF bring to the focus countries. And here you can see the leverage capacity that GFF brings to those countries where, with a commitment of spending roughly 30% of all country investments in the future in nutrition, we can expect to leverage almost 10 times more resources from IDA in these countries. And this is, again, a huge benefit for strengthening the nutritional efforts at the country level. Next slide, please. With Japan's support and the support from others, GFF is launching a new roadmap for the next 5 years, a roadmap that will, again, take almost 30% of all its country investments into nutrition-related interventions, signaling the importance of nutrition in the overall health agenda, and a roadmap that will also integrate better data and accountability, innovations, and also, very important, wider spaces for private sector engagement in this important public agenda. Next slide, please. In the last section of this brief intervention, we want to share with you all a couple of country experiences where the Japan Trust Fund and GFF, working together with other stakeholders and with the country leadership and ownership, have been able to contribute to better nutrition outcomes. And this is important for all of us to learn from these experiences, to see different alternatives, and to make the proper country choices, again, in tackling stunting, malnutrition, obesity, etc. Next slide. Our first example takes us to Senegal, by the way, a country that I'm looking forward to visit tomorrow and to learn from in those days where I'm gonna be with the privilege of learning from this experience. Senegal has been an incredible example for all of us. It has been a successful story in reducing childhood malnutrition. It has been able to maintain proper progress in such effort, even in years of economic hardship, proving the importance of a comprehensive nutritional approach that has a combination of domestic efforts, of IDA resources, and contributions from the Japan Trust Fund and the GFF facility as well. This comprehensive approach, again, has been able to, in a continuous way, address the stunting challenge and the malnutrition challenge in Senegal. Next slide. And the second example comes from Rwanda, which has also another very interesting and comprehensive effort around stunting. And this effort has, for those of us who have a public health heart, it has a very important message, and it's always think about the determinants of health when you see an expression like malnutrition. These determinants of health are addressed in the Rwanda country case through specific stunting prevention interventions, but combined with social protection interventions like conditional cash transfers and demand-side interventions, with very important education activities strengthening basic primary education, determinant of health and of nutrition, and Martin, of course, working across sectors with agriculture, looking at food security, and looking at other nutrition-sensitive aspects in the agricultural sector. With this combination, and with the contribution of other partners, like the Power of Nutrition, Rwanda has been able, again, to be a successful story and to share a very positive experience with all of us. Let me please now conclude with the last slide. Moving forward, with the Japan Trust Fund, with the GFF, with other partners who are so much engaged and committed to nutrition globally and regionally, we all need to work around these critical issues. We need to keep on doing analytical work to fill important knowledge gaps and every day know more about these nutrition challenges. We need to make a strong case for nutrition investments country by country. We need to recognize that investing in nutrition is important. We need to develop the systems and the capacity for implementing such interventions and enhance in those interventions the quality and the efficiency, both of the services and the expenditures. And finally, we need to be always open-minded for innovations and for more to bring value added into nutrition. With this last slide, I want to thank the organizers. I want to thank Japan. I want to thank you, Martin, for your generosity in sharing this, and for all of us who working together, I'm sure we'll be able to continue this roadmap for better nutrition in our world. Thanks so much.
Very good. Thank you very much, Juan Pablo. Excellent intervention and presentation. Now let me turn to our next speaker, Dr. Suprayoga Hadi, who is a Deputy Minister for Human Development, Policy and Development Equity, Office of Vice President in Indonesia. Dr. Hadi, what has been Indonesia's experience and achievement in integrating nutrition into the national health programs and your universal health coverage strategy And what do you see as the added value of catalytic financing like the ones that Japan has provided? So those are a few questions for you to cover, Dr. Hari. I mean, you have 5 minutes.
Okay. Thank you, Martin. And thank you also for the World Bank, Government of Japan, also the GFF for having me, sharing maybe Indonesian experience working on the nutrition issues, or especially the stunting. Of course, Indonesia has already been, launching national strategy for accelerate stunting reduction since 2018. That aims reducing the stunting rate from 33% in 2018 to 14% in 2024, which is 2 years from now. Actually, the national strategy focused on the scaling up a package of high-impact nutrition-specific and nutrition-sensitive intervention. And the program includes actually quite, a big, group of line ministries. About 23 line ministries already been involved, and it's being scaled up to all districts and municipalities in Indonesia in 2022. And more recently, actually, the government of Indonesia already enacted the presidential regulation number 72 this year, actually enacted in August 5th, 2021, as the legal basis for the program. And since launching the national strategy back in 2018, actually Indonesia has demonstrated quite remarkable progress in stunting reduction, with rate stunting dropping from 33% in 2017 to actually 24% this year. This is very quite remarkable amidst the COVID. But COVID pandemic has potentially disrupted the good progress actually in stunting reduction, and affected nutrition services delivery at the health facility and also community level, as shown by recent data, indicates that almost 80% of the village health posts reported closure. And UNICEF actually expect that this year, 24 million toddlers will be at high risk of malnutrition and chronic malnutrition due to COVID pandemic. As your question, actually, health sector program under the universal health coverage strategy play a very critical role in delivering quality nutrition specific intervention, and particularly at the community level to ensure that the services reach out to the most vulnerable household. It is important to ensure that the essential health and nutrition services are being protected to mitigate the further impact of the COVID-19. And of course, to integrate the nutrition in the health sector in the context of mitigating the effect of the pandemic of the COVID-19, it is quite clear that the president has demonstrated a high-level commitment actually for maintaining the continuity of the essential health and nutrition services and securing a budget dedicated to stunting program to mitigate the effect of COVID-19 pandemic on nutrition outcomes. The government also recognized that the need to address COVID-19, but also what we call the trade-off actually cannot be at the expense of the women and the children. The realization of the investing in nutrition outcomes is the most cost-effective with the long-term effect. It is very, very clear to contribute to the future economic growth.
Mr. Hari, you have 1 more minute.
Yes. We know that the catalytic financing provided by the Japan Trust Fund as well as the JFF partnership is very significant and contributed to us actually. And in this sense actually, JFF, World Bank, and also the Japan Trust Fund technical assistance have also enhanced accountability actually, mechanism that has contributed to strengthen government oversight capacity through the establishment of the monitoring and evaluation unit and monitoring dashboard. And finally, actually, if I may make it clear as the closing statement, it is like the summary actually of some key point of the role of the catalytic financing and implementation of the multi-sectoral nutrition program in Indonesia. First is on the strong political commitment. It's very clear from the highest level of the government to the village level. The JFF partnership with the World Bank and the Japan Trust Fund, catalytic financing and technical assistance to to scaling up actually innovation, sharing knowledge, and facilitating coordination and alignment with partners have been critical component in our effort. And finally, government has been the driver's seat. This is very clear, providing clear guidance to the development partners and all key stakeholders on the program targets, priority intervention to scale up, and critical reform, actually to optimally leveraging the catalytic financing. And finally, we will further strengthen our partnership with the GFF, World Bank, and Japan Trust Fund for scaling up nutrition as the key area in such strengthening the partnership with private sector, improving the use of data for decision making, and also strengthening the quality of nutrition and intervention to optimize the impact. Thank you, Martin. I think that's all from myself.
Very good. Thank you very much, Dr. Hari. Now let's turn to our next speaker, Ms. Nadine Umitoni Gatsinzi. She's a Director General of the National Child Development Agency in Rwanda. So, Ms. Nadine, so Rwanda is doing extremely well in addressing malnutrition, as Juan Pablo also said in his intervention. So how did the country do this? And how did you integrate nutrition into national health programs? And what lessons can you share from the strategic use of catalytic financing for the impressive scale of nutrition programs within universal health coverage, but also multi-sectorally? So those are a few questions for you to cover in your 5 minutes. Over to you.
Thank you very much. And also we thank the government of Japan through the Ministry of Finance for inviting Rwanda to share our experience in tackling malnutrition and stunting through a multi-sectoral approach, as you said, and the mainstreaming of nutrition in the health national programs. In Rwanda, every 5 years, we publish a demographic health survey report, and the one of last year shows us that stunting is quite still higher. We have 33% of our children under 5 who are stunted, and our target in 2024 is to have at least 19%, and as our minister committed earlier, 10% in 2030. Another important nutrition program we have is anemia among children from 6 to 59 months. That stands at 36%. We have anemia in adolescent girls that stand at 14.7%, and anemia in pregnant women that stands at 24%. The most important underlying cases of stunting and anemia that I would like to highlight here is poor complementary feeding practices and the consumption of animal source foods. Since 2017, in order to solve the persisting nutrition problems, especially among the children, we are taking a multi-sectoral approach. The government of Rwanda has established a central level coordination mechanisms under the Prime Minister's office, but coordinated by our agency, the National Child Development Agency. And in close collaboration with GFF, as highlighted by Pablo, and World Bank, through this multi-sectoral approach, now we have developed a 5-year strategic plan and a single action plan that serve as investment case. The plans prioritized high-impact interventions, identified concrete results and targets, clarify how sectors can contribute, and established a monitoring system and financing strategy to achieve results. The Ministry of Finance, in collaboration with the Ministry of Gender and Family Promotion, again with the strong support from GFF and World Bank, we have issued a ministerial instruction on nutrition budget tagging that requires relevant sectors to prioritize the investment case high impact interventions in their budgeting processes to ensure that they are funded. We have also been able to establish a robust monitoring system and promoting the use of data in our programming. Thus, with the support again with GFF and World Bank, we have an integrated child development dashboard, we have a child scorecard, and we have an innovation called Child Length Mat to track the simultaneous access of priority nutrition and early childhood development services at the household level and child level. Through also the JICA support, a sector policy loan for nutrition improvements through agriculture with specific policy actions to substantially enable environment that favors more investment in nutrition across sectors was concluded between Rwanda and JICA. To respond to the question about the mainstreaming of nutrition into health, many of the nutrition services in Rwanda are delivered through the health system. which in many cases is covered again by our community insurance coverage. And the routine nutrition data are covered by using the health information system. In addition, several nutrition-specific and sensitive interventions are adequately addressed into health sector plan. These include, but are not limited to, strengthened surveillance and prevention of malnutrition as part of antenatal care, providing maternal, infant, and young children nutrition counseling, providing growth, monitoring, and promotion at health facility levels, including interventions and referral. At community level, we have 4 community health workers who provide community-based health and nutrition services, including growth monitoring, promotion, prevention, and management of moderate malnutrition, providing deworming pills every 6 months for children under 5 years, and providing level nutrition education, community level nutrition education, and counseling through village level cooking demonstrations as part of the
1 minute, Ms. Nadine, you have 1 minute.
Nutrition program. The community health, to conclude, the community health performance-based financing schemes accommodate key nutrition indicators alongside other selected health indicators. So to conclude, our partnership with the World Bank, GFF, and JICA partnership, especially technical assistance and catalytic financing in implementing financing and service delivery reforms, scaling up innovations, sharing knowledge, and facilitating coordination and alignment with partners have been a critical component in our efforts. Further, we want to strengthen our partnership with World Bank, GFF, and JICA in specific key areas, including improving the use of data for decision-making, especially at the centralized level, also strengthening the quality of integrated early childhood development services for stunting prevention and reduction of malnutrition to optimize impact. I thank you very much.
Very well. I mean, thank you very much, Ms. Nadine. So let me turn to the next panelist, Mr. Tadisi Sato, who is the Vice President of the Japan International Cooperation Agency, JICA. Mr. Sato, I have a slightly different question for you. I mean, what kind of partnership and collaborations can be harnessed in mainstreaming and planning and implementing nutrition programs that focus on country capacity and financing strategy? It's quite a question. The floor is yours. You have 5 minutes.
Thank you, Mr. Chairman. And thank you, the organizers, for inviting me to this valuable event. I'd like to respond to these questions using slides. Thank you. Next slide, please. First, let me share our nutrition policy compiled as 10-point JICA Nutrition Declaration published yesterday. It includes promoting multi-sectoral approach, utilizing Japan's experience, employing various tools, focusing on Africa, with the initiative of Food and Nutrition Security in Africa, or IFNA, and cooperating with international partners, among others. Next slide, please. Well, in Ghana, JICA has promoted the universal health coverage that includes nutrition through effective use of maternal and child health handbook, which was initiated in Japan. And this handbook is also promoted in Indonesia first, but we are also promoting them in Africa now. Well, the outcome of this project in Ghana has been scaled up by UNDP, UNICEF, and World Bank. Their projects helped Ghana digitize, print, and utilize this handbook. Next slide, please. In Rwanda, JICA has promoted nutrition-sensitive agriculture and a multi-sectoral approach for child nutrition by a first policy loan based on IFNA. I think Ms. Gattini have already made reference to this support. Well, to maximize the impact of this finance, we made also collaboration with JICA's other projects, such as irrigation, by incorporating nutrition element in their technical guidelines. We also created multi-sectoral monitoring guidelines and tools, which complemented the interventions in the health sector by the World Bank. Next slide, please. Let me also introduce 2 cases of multi-sectoral collaboration for nutrition. In Madagascar, JICA's support is for agriculture, while the World Bank is for health. Their targets partly overlapping. In Mozambique, JICA started 3 technical cooperation projects, individually in agriculture, health, and wash sectors, but under the common goals in the same province. Next slide, please. So finally, I would like to suggest some ideas for further collaboration between the World Bank and JICA. The both organizations already have a good basis of collaboration, such as regular communication at the headquarters and local levels, common frameworks for nutrition cooperation like IFNA, and as I have shown in my presentation, some good practices. The first case for collaboration is scaling up the JICA's successful technical tools like maternal and child health handbook under the policy frameworks and programs that the World Bank supports. The second case is that JICA and World Bank co-finance policy loans for nutrition, the ones like in Rwanda, and expanded resources can generate larger impacts and target more countries. Next slide, please. The third case is a collaboration in which JICA targets food provider side and World Bank targets food consumer side, or vice versa. This kind of collaboration can bring better access to nutritious food for consumers and larger market for providers in developing countries. And the fourth case is for a multi-sectoral collaboration in general. In this case, JICA and World Bank conduct different projects for different sectors. But by overlapping the target areas and period under the common goals and indicators, we can maximize synergetic nutrition impact together. I think, I hope this answers your questions. Thank you. This concludes my presentation. Thank you for your attention.
Excellent. Thank you very much also for highlighting the multi-sectoral approach and the collaboration with the World Bank. Very good. Now let's turn to our final panelist, which is Mrs. Mati Dia-Wandeler. I mean, she's the partnership manager for the Global Financing Facility Civil Society Hub. So Ms. Wandeler, I mean, what kind of partnerships and collaborative work have you seen effectively move the needle, I mean, to mainstream nutrition in the global health and development agenda, including in business and in civil society organization? The floor is yours and you have 5 minutes. Over to you, Martin.
Thank you. Thank you very much, Martin. Good morning, afternoon, evening to participants and my fellow panelists. I'm very, very honored to be here and take part in this conversation. As you said, I'm working with an organization called PAI based in Washington, DC, and focused basically on advocacy, accountability around sexual reproductive health. I also represent civil society organizations at the GFF Investors Group. I think to respond to your question, we have as CSOs several roles. We are close to communities, understand their needs, priorities, and one of the things that we've been able to do, thanks to the GFF, because of the catalytic and partnership model, we've been able to come together and work across sectors, not only family planning, sexual reproductive health, social determinants of health in general, worked in partnership to advocate for increased financing in health, looking at the intersectionalities that a lot of the communities we serve are faced with. So we've been working very, very strongly on efficient advocacy, looking at what are the priorities of the communities, particularly young people. There's been a lot of focus in the last few years on adolescent health, and how have we been able to advocate for, influence, but also monitor the spending and the service delivery that is supposed to be provided by civil society, by the government to communities. So through the partnership of the GFF, we've been able to be included and added into the planning processes, into the monitoring and the implementation of national country investment cases. As this has been, the inclusivity of the GFF has allowed for this to happen at country level, but also at global level. And we have been, in this model of work, we have been able to advocate for the integration of nutrition services in national investment case with clear indicators on nutrition, making sure that we work not only at the local district, but national level to ensure that these indicators are included in investment cases, but also are monitored throughout the implementation. Integrating nutrition is not always obvious, and sometimes stakeholders, not only communities, but also some of the policymakers do not understand how to integrate this and what is the interconnection and the need to integrate. We are asking the same health workers to deliver on immunization, on nutrition, on family planning, and on other issues. And it's the same health workers who are overwhelmed. So for us, it is critical for all stakeholders to take part in this and understand the need for this integration to be mainstreamed. We have been trying to address these structural barriers through our partnerships, including the private sector, including governments, including members of parliament who have been advocating for this. And because we are using this multi-sectoral and intersectional approach, you have the same woman who goes to the health facility might be looking for family planning services, but she has a child who has malaria or who is malnourished or who has missed a dose of immunization. So it's really important for us to approach our work through this, to have a primary healthcare approach in delivering services, but also in the work that we do on advocacy and on accountability, looking beyond the health sector. As Juan Pablo showed in the examples of Senegal, Rwanda, we have Madagascar, we have several countries where CSOs are engaged deeply in the GFF dialogue. And this has been—
You have 1 minute, can you wrap up in 1 minute, thanks.
And it has been, with this model, really, really critical for civil society to advance their agenda, but also for the government and for the GFF to see civil society as key partners. Maybe before I leave, one thing that I would like to add is, we talk about the human capital, but one of the challenges of integrating nutrition at country level, we have several funding sources with sometimes different funding cycles from different donors. So it's really important for us to see, maybe leverage the partnership model of the GFF to channel funds, to have an integrated approach to mainstreaming malnutrition in these services. So my expectation goes beyond the World Bank and the GFF. It's really this idea of aligning funding, coordinating the work that is being done at global level, so that it translates into the integration of nutrition in national health policies and programs, reinforcing governance and accountability. Thank you very much, and over to you.
Very good. Thank you very much, Ms. Mulder. We're running a little bit behind time, but I think we still need to do, we still should do a number of Q&A, a number of questions that are posted in the chat. So I propose, to go quickly over those questions, and each panelist will have about 1 minute, to respond to a few questions that have been put forward. The first question is from the Honorable Ms. Noriko Furuya. She's from the House of Representatives, the Deputy Chief Representatives of the Komaite Party. It's a question that I would like to direct to Mr. Hadi. What are the challenges in executing budgets allocated to health and nutrition of women, children, and adolescents in rural communities? So 1 minute for you for a few highlights in response. Over to you, Dr. Hadi.
Okay, thank you, Martin, and thank you also for the question. Very, very nice question. I think on the basis of the target group, it's already been identified very clearly, actually, in our case in Indonesia, that we've already been trying to make some survey, actually, of the family throughout the nation. And we have already been identified with a target group that already been targeted and prioritized in this case. And we've already been trying also to put our attention, actually, in involving actually the village level apparatus, and also the officers actually at the village level that very close to the target group, to help them on the basis of the service of what we call the community health center. And it's going to be very appreciated, and also very much related with what the problem they've been facing actually. And the delivery of the services already been in line or aligned with what the people needs actually on the village level in this case. So the service is very much related with that. Thank you.
Excellent. Very good. Thank you very much. The next question I will direct to Ms. Nadine as well as Ms. Wandeler for each 1 minute. And the question is the following. I mean, other than awareness raising, I mean, what are the actions, interventions to address the double burden of malnutrition? So Ms. Nadine, you want to go first for 1 minute, and then we go to Ms. Wandeler for 1 minute. Ms. Nadine.
Yes, very important question. The one we can do to tackle that issue, as we did here in Rwanda, I mentioned earlier, is about to approach this issue in a multi-sectoral way. And in Rwanda, we have also took that route of implementing what we call an integrated early childhood development, where we look at the child in all the aspects, different aspects, being health, being nutrition, being the early learning, being the child protection, being the positive parenting, the environment of the family. And when we approach this issue in that way of multi-sectoral and looking at different aspects, it really helps into responding to the issue of malnutrition and tackling it in a comprehensive way. Thank you.
Very good. Yeah, so what are the actions, interventions to address the double burden of malnutrition? So Ms. Wandeler, 1 minute for you.
Yes, thank you. I think the previous panelists responded on one of them, taking the child and adolescent as one, and looking at the different issues that they're suffering with. I think the social determinants of health are critical. We're talking about human capital. Let's look at the education of the mother. Let's look at the child marriage issues. In a lot of the countries we are working in, child marriage is huge. Girls are married very young. They're not educated. They don't know how to take care of their children. So I think looking at that intersectional lens in tackling malnutrition and working across sectors, working with a bottom-up approach, asking communities what is it that they're suffering with, they're struggling with, working with these communities to address these issues is critical, and having a primary healthcare approach is the only way to go if you want to reach that mainstreaming of nutrition in primary health services. Thank you.
Very good. Bottom-up approach. I mean, that's the key word here. The next question, 1 minute answer, is for Mr. Sato. And the question is the following. So the Lancet and the IPCC reports say that a dietary shift are a major opportunity for not only the nutrition improvement, but also for reducing greenhouse gas emissions. So what research you think would be needed to move this agenda forward? Mr. Sato, 1 minute.
Okay, thank you very much. It's a very, how should I say, dynamic question. Well, nutrition needs to be addressed, not only human health, but also planet health. Well, I think the basic diet in every country should be based on the local production, and how to encourage local production, which is good to human health. And I believe it also contributes to the climate change and other environmental problem. But at the same time, we at this same time have a challenge of climate change. So we also have to address how to adapt to this new crisis. So we also have to deal with more, not only nutrition, but more broadly, how to make sustainable food systems, and that will serve
Yes.
the both purposes. Thank you very much.
Very good. Yeah, I did. This is, of course, an important question. And clearly, you know, I mean, the carbon footprints of healthy diets is less than conventional diets. So there's a clear, you know, benefit there. Also, reducing food loss and waste, I mean, will be very beneficial for food and nutrition security, and of course, also for the climate agenda. So there's a lot of kind of convergence here between healthy people and healthy planet. I mean, they go hand in hand. Now, for the last 1 minute question, I go to Juan Pablo. Juan Pablo, I mean, what are the current interventions, I mean, and challenges and future opportunities for nutrition-sensitive approaches? So 1 minute for a quick reflection, Juan Pablo.
Martin, thanks. And 5 seconds to congratulate you for the moderation role. Very quickly, and repeating ourselves, because it has been an incredible panel, I would say a nutrition-sensitive approach needs to be multi-sectorial and aware of the determinants of health. It has to be evidence-based and very focused. It has to be sustainable and sustained in the longer term. It doesn't serve to only be short-term. And finally, it needs to be country-owned. And Mati, very nice seeing you. It also needs to be community-owned. I think those are key characteristics. Now, challenges, they come from the characteristics, Martin. We need to prioritize nutrition among so many needs. We need to be able to work across sectors, ministries, institutions, and that implies governance, implementation, and accountability challenges. And we need, and this is my conclusion, because it's the opportunity, we need to integrate nutrition to the health systems. As Dr. Takemi said at the beginning of this panel, this is the opportunity with an equity focus, starting with those most vulnerable, make nutrition a comprehensive and core activity, effort, and purpose of our health systems.
Very good. Thank you very much, Juan Pablo. I think, you know, there are other questions that were posed to the chat function and, you know, related to what the bank is doing in countries with high stunting rates like Madagascar and the Sahel. I mean, the questions about country ownership. So we will be responding to those questions in writing. So let me just take this opportunity to kind of wrap up the panel. First of all, I would like to extend a very big thank you, I mean, to our 5 panelists, I mean, for their excellent intervention. And also a big thank you to everyone in the audience for participating and contributing to make it such a rich discussion. I have 3, I mean, takeaways. I mean, kind of extracting from the interventions and the discussion. I mean, the first is that nutrition is very much a key part, you know, of the World Bank and countries' agenda, and this will be also a high priority for the bank under IDA 20. As a World Bank group, I mean, we approach nutrition from many angles, as you have heard, and work across many sectors, depending on the country context and the demand. In the health sector, that's my second remark, we focus on including nutrition with universal health coverage. In addition, we address nutrition to our agriculture and food portfolio by focusing on strengthening food systems. In social protection, we link cash transfers for the poor for improved nutrition behavior. It's very important. And each of the panelists have referred to how they did this within their country context with support from the Japan Trust Fund and the Global Financing Facility. And last, let me say that by that getting nutrition right, I mean, can catalyze transformation of our food systems to one that is not only productive and resilient, but also improves health and nutrition and delivers climate benefits, as we just discussed. I mean, for example, I mean, policy support for the repurposing of agriculture subsidies and expenditures is one such form of investment that is at the nexus of the universal health coverage strategies and sustainable agriculture systems for healthier people, healthier economy, and a healthier planet. So I think the last 2 days have brought very significant political and financial support for nutrition and food security. And now our implementation tasks begin, and Japan's contribution to support this implementation is absolutely critical. So thanks very much again to all the panelist participants. And now back to you, Mr. Okawara. Thank you.
はい、ワン・ニューコープグローバルディレクター、ウリベさんおっしゃったように、素晴らしいモデレーターとしての、そして最後も立派な総括をいただきましてありがとうございます。そしてパネリストの皆さんもどうも大変ありがとうございました。インドネシア、ルワンダをはじめとする各国における栄養改善の取り組みには、JICA などの開発パートナー、各国内の CSO など多様なアクターとの連携が不可欠であるということ。そして、ウリベさんも先ほどおっしゃいましたけど、栄養改善を UHC 政策へ主流化していくということが、女性、子ども、青少年など脆弱な人々へサービスを届け、健康を改善していくには必須であるということが、皆さんのご説明で大変よく分かりました。ありがとうございました。では、最後に、三村淳敦財務省国際局長より閉会のお言葉をいただきます。三村局長、よろしくお願いいたします。
恐れ入ります。大川理事長、ご紹介いただきましてありがとうございます。三村でございます。海外からご参加いただいた方に敬意を表しまして、クロージングスピーチ、英語で、お話をさせていただきたいと思います。So, good evening and good morning and good afternoon to all participants. I'm Atsushi Mimura, Director General International Bureau of the Japanese Ministry of Finance. First of all, let me thank the colleagues of the World Bank Group, GFF and JCIE for co-hosting together with us this very exciting side event at the occasion of this Nutrition Summit. I would also like to appreciate participation and valuable thoughts of Professor Keizo Takemi, Managing Director Mari Pangestu, and all distinguished panelists today. I was really excited with your active discussion. I think the discussion at this event has reaffirmed the importance of nutrition on the global health agenda. Professor Takemi stressed that nutrition is a critical factor to be highly focused in achieving universal health coverage, or UHC. MD Pangestu highlighted long-standing partnership between Japan and the World Bank Group in advancing nutrition agenda. And panelists, as was just summarized, pointed the importance of mobilizing resources for nutrition, mainstreaming nutrition into the global national health agenda, and engaging various actors in promoting nutrition on the ground. In closing this event, I would like to highlight 3 points from the perspective of Japanese Ministry of Finance. First, mainstreaming nutrition as a core part of the UHC is important not only for enhancing human capital, but also as the economic policy to achieve sustainable economic growth. Investment in nutrition can bring very large economic returns. According to the Global Nutrition Report, preventing malnutrition delivers $16 as returns for every $1 investment. Secondly, as Professor Takemi mentioned at the beginning, nutrition is also a critical factor in enhancing prevention, preparedness, and response, the PPR, for future pandemics. The COVID-19 has revealed the significant weaknesses in the current global health architecture. Nutrition can address such weaknesses by building up immunity and making people less susceptible to infectious diseases. We will continue to discuss this challenging issue of PPR, prevention, preparedness, and response at the G20 and many other international fora with key partners, including, of course, the World Bank Group. Third, in order to shed light on nutrition in promoting UHC and PPR, collaboration between finance and health authorities is indispensable. While health ministries are in charge of designing high-quality, financially sustainable, equitable, and inclusive nutrition policy, this important mission cannot be completed by health colleagues alone. We, finance authorities, have a joint responsibility in designing and securing financing sources. With these 3 points in mind, Japan has been striving to support developing countries to improve their capacities in creating and implementing policy plans on nutrition. This is exactly the reason why, as was introduced by MD Pangestu at the beginning, at this occasion of this Tokyo Nutrition for Growth Summit, Japan reaffirms its commitment to contribute additional $50 million to the GFF and $20 million to the Japan's Trust Fund for Scaling Up of Nutrition, the SUN, for a total of $70 million to advance partnership with the World Bank Group. Finally, Japan strongly supports IDA 20 replenishment, which will prioritize investment in human capital, including maternal and nutrition services, as one of its key policy commitments. This is a meaningful step to direct significant resources of IDA to nutrition in combination with catalyzing function of GFF. Japan will host IDA 20 final replenish meeting next week, and we will make our best efforts for its success in cooperation, of course, with the World Bank and other donors. So again, thank you very much all for your participation in this very exciting side event. And I really hope we will be able to continue this important work towards nutrition for everybody. Thank you very much.
三村局長、財務省の立場から大変前向きな力強いメッセージで締めくくっていただきまして大変ありがとうございます。これで本日のイベントを終了いたします。武見先生、マリー・パンゲスト専務理事、そしてパネルディスカッションにご参加いただいた皆様、そして視聴いただきました皆様にこの場をお借りして、改めて御礼申し上げます。最後に簡単なアンケートを実施させていただきます。お時間に余裕のある方はぜひご回答いただければと思います。アンケート結果はそれぞれの共済機関の今後の活動の参考にさせていただきます。改めまして、今回は皆さんご参加をいただきまして大変ありがとうございます。以上で本日のイベントを終了とさせていただきます。ありがとうございました。